Today we have Dr. Rohan and he is practicing in Mumbai, Maharashtra. We're going to be talking about kidney stone management because it's a very prominent and very persisting topic of these days. So very welcome.
Hello.
So why according to you are the cases of BPH is on high rise these days?
No, see, basically BPH is a disease or a disease of old age. So as the age advances, the probability of patients having BPH is on a more side. Probably right now with lifestyle where patient have lot of diabetes, probably they are obese, living for a longer time, the incidences of BPH are on a higher side right now.
Right. Well, why does it become so important for a patient to get it diagnosed at an early stage and not delay the process?
See, getting diagnosed at an early stage is very important. The more the patient, delays his problem, the chances of his bladder getting affected because of prostate is on a higher side. Patients may land up with, underactive bladder with compromised kidney function at a later stage. So it is better to be diagnosed at an early stage.
Any instant or any case you can recall from your practice which was the cause of the delay in diagnosis?
So basically that patient who came to me, almost he had urinary complaints for almost 5 to 7 years, but delayed and later came with the bladder getting over distended, with both the kidneys getting fired, with gross hydronephrosis, creatinine getting on a very higher side, landing up with bladder stones. So simple case getting turned into a complicated one only because of ignorance is a main issue in India.
How did you tackle that patient?
See, patient came with totally with overflow incontinence, in the sense bladder was totally full, with both the kidneys were showing gross hydronephrosis, create on a higher side. The earliest step is to just put in a catheter, drain his bladder, empty his bladder, give rest to the bladder, decompress the kidneys, and wait for creatinine to come to a nadir level or a baseline level. Right. And once the creatinine comes back to the normal, then definitive surgical management is the option.
Well, when do you think is the surgical intervention becomes a necessity, and are there any chances to avoid the same?
Yes. So right now, currently in market, there are a lot of medical, medicines which are there to tackle BPH and its problem. So almost to the tune of 70 to 75% patients, usually they don't need surgery if they stick and follow up regularly with medications. Only those patients who go into recurrent retentions despite of taking tablets, or whose quality of life is getting hampered, or if the flow is not getting improved despite of taking alpha blockers, or if getting complications because of BPH, in the sense they are having hematuria, probably they are getting bladder stones or getting recurrent infections, so these, or getting his kidney functions getting compromised, these are the cases who need surgical intervention.
Well, any lifestyle modification that
Yes.
are a must for a people between the age of 40, 50 to avoid BPH?
So as such, no one can avoid BPH. It's a disease of old age. So, but there's definitely healthy lifestyle. As I've said earlier, also obesity is a prime, reason for patients to have a larger gland. As accompanying diabetes is also a main reason for patients having lower urinary tract symptoms. So, getting your body weight under control, regular exercises, having healthy lifestyle in the form, avoid junk foods, doing regular exercises will help at least prevent the lower urinary tract symptoms to a certain extent. Just a second, sorry.
Well, any take-home message or anything you would like to add to the topic which I might have missed?
It's better to get diagnosed at an early age, do some sort of blood tests which are needed in the form of serum PSA starting from the age of 55. Don't ignore any sort of urinary complaints कि हाँ ये तो बुढ़ापे में होता ही है, कि थोड़ा रात में उठना ही पड़ेगा ज़्यादा बार, थोड़ा यूरिन का फ्लो कम होने ही वाला है. इस तरह को डिले नहीं करके जल्द से जल्द अपने यूरोलॉजिस्ट को मिले, यही एक मैसेज रहेगा.
Thank you so much, sir, for your valuable insights. We are very glad to have you. Thank you.